A lot of times when it comes to issues with the skin, the hair, the nails, people tend to go online. They Google the answer. They try to seek out other people in other fields.
When one turns to social media, word of mouth, sometimes one can end up down the wrong path or pursue treatments that might be harmful to the skin or just simply not effective.
Instead of taking matters into your own hands, you deserve to see an expert in the field. As board-certified dermatologists, we are qualified to take care of issues happening with your skin, your hair, and your nails. So allow our many years of schooling and training and passion to understand what's going on with you, allow us to share that with you.
It's very important that patients know the training behind who they are seeing. So board-certified dermatologists obviously have a significant amount of training. Undergraduate degree, a medical school training for 4 years, an internship, dermatology residency, and oftentimes fellowship training. So the degree and the path that your doctor takes is very important because they need to have those training experiences to be able to offer you a lot of options.
You want to have a physician who's going to be able to treat you with cultural competency, make the accurate diagnosis, and then give you the best treatment for your problem.
So while all dermatologists have special training in everything hair, skin, and nails, seeking out someone with training and expertise in skin of color is especially beneficial because we understand the very specific needs and also nuances that occur in people of color.
With people with brown skin, we have more melanin in our skin. That melanin can be very hyperactive. That means that in response to trauma or inflammation, things happen. That melanin count can go up or down. And so you have to be aware of those things when you're treating and diagnosing someone with brown skin.
There are certain variations in how skin conditions look across different skin types. For example, the erythema or the redness that is very apparent in lighter skin is not so obvious in darker skin. And so that can make it difficult to sometimes diagnose common skin conditions like psoriasis or even serious infections like cellulitis.
We see unique manifestations of common conditions in melanin-rich skin, common conditions such as eczema or atopic dermatitis, psoriasis, acne. Then we have a set of disorders that disproportionately affect people with skin of color. There's some specific hair and scalp disorders, keloids, pigmentary disorders, and others that disproportionately affect people of color.
A lot of our metrics and our tools in clinical trials also use instruments that may not actually appropriately classify the disease in skin of color patients. That's why it really requires someone who has experience with these patients and can really, start the right therapy at the right time.
So we can give you advice on medical procedures that are intended for you and can really help your condition. We can also help you to avoid a lot of the pitfalls out there that can lead you astray and end up really causing you more problems.
You don't have to suffer with whatever is going on in your skin or your hair or your nails, and you should see a board-certified dermatologist to be able to help with that.
People who are looking for a dermatologist specializing in skin of color, of course, I always recommend that they seek out information from the Skin of Color Society website.